provides the degree of contraception protection. Okay, before 6 months of age, the newborn, the mother has this okay, lamb, okay, which protects them from getting pregnant. Okay, so breastfeeding really helps, okay, and promote good nutrition to the newborn as well as protection to the mother. Okay, there are researches that says that exclusive breastfeeding prevents cervical cancer as well as breast cancer. Okay, so now on the other side, the care of the breast. So breast engorgement may cause discomfort during late pregnancy, and a well-fitting brassiere can give relief. Okay, so we advise my students in midwifery during their community primary health care duty in the health center. My students will do the lecture with regards to this matter. Okay, they were the ones who lectured the mother. Before the mother is being given the prenatal checkup, we have this educating the mother. And even we also include pill health in education, and of course, their plan, okay, birth plan. Okay, we have this birth plan. What are their plans when they are about to give birth? Okay, the companion of choice, the things they bring, and of course the money, how much money they need, okay, for the newborn screening, okay, and where to go, where is the nearest lying-in clinic or where is the nearest hospital. Okay, we educate all those women during their prenatal checkup. Okay, so they are informed already. Okay, so with regards to breast engorgement, we also advise them what to wear. Okay, if their breast is being engorged. Okay, so there is a holistic care for the women during pregnancy, brought about by education. Next slide. Okay, now for the family planning. This is also very important. Breastfeeding and contraception. The benefits of breastfeeding, it lowers the risk of maternal and maternal mortality for the mother, fetal death or miscarriage or stillbirth in neonatal, okay, anemia in the mother, postpartum inflammation of the endometrium of the mother, and premature rupture of amniotic membranes, as well as premature birth, intrauterine growth retardation, and low birth weight, malnutrition of newborns and infants due to insufficient breast milk. Okay, so we encourage every woman. So in the health center and even in the health facility, in the hospital, no bottle is being allowed to enter the facility. Only the mother, okay, will give milk to the infant. No bottles, no formula milk. Okay, because we have this law, okay, the milk law, okay, no? So, okay, every mother is not just encouraged, but it is a mandatory to breastfeed their children. Okay. Next slide. Okay. So, I have heard earlier about the question on postpartum blues. Okay. So, I heard Mom Ribeka saying family support. Yeah. Family behavior and attitude should be pleasant and encouraging while the mother is pregnant and postpartum as well. Family should ensure provision of healthy diet and timely visits to health facility. So you can see in the picture, the father is there, okay? The mother or the in-laws of the pregnant mother after giving birth, they are there. They are complete, very supportive. And of course, we also say avoid delay in contacting medical facility when labor starts or in case. So at 7 months, the mother is being told that you should prepare your bag for yourself and another bag for your baby. Okay? Everything must be ready. So ready to go. Okay. Adequate finance and transport should be arranged beforehand. Okay. Are they riding a car, a tricycle, a pedicab, or whatever, a taxi? Okay. So they should have plan for that. Okay. Or they just walk to the lying-in clinic if it is near. Okay. And of course, a blood donor should be identified for any unforeseen emergencies. Okay. So there must be blood donor. Okay. Care and support by husband and mother-in-law gives an emotional support and confidence in childbearing, not just in childbearing, as well as during pregnancy and after pregnancy, just during postpartum. Remember that the mother is really very tired during labor and delivery. She needs somebody to take care of the newborn. Okay, the mother needs additional sleep. Okay, every time the newborn is awake, the mother is also awake. So every time the newborn or the infant is asleep, the mother should also sleep to recover for the lost strength. Okay, so family support is very important, most particularly the support of the husband. Okay, next slide. Okay, what are the danger signs during pregnancy? We should also educate the mother with regards to danger signals during pregnancy. If any complications occur, seek help immediately to preserve the health of the mother and the baby. Okay, for example, severe pain in the abdomen. Okay, false uterine contractions may lead to true labor contractions. Okay, so you must go to the facility as early, very early. Generalized weakness, easy fatigability, and breathlessness. This may entail there is a cardio problem or heart problem of the mother. Excessive swelling in legs. Okay, we can advise the mother with regards to this one that they can lift their legs to minimize edema in their legs. But if this is really excessive, it is also a signal of some complications during pregnancy. Okay, if the mother has diabetes, okay, and of course bleeding per vaginum, meaning okay, miscarriage on the first try or second try, okay, there can be miscarriage or abortion. Okay, so the mother should go to the attending physician for advice. Okay, so for sure there will be bed rest. The doctor may have complete bed rest, okay, to prevent the continuance of bleeding, okay, to preserve the pregnancy. And of course, convulsions, okay, uh, this is very alarming, convulsions, okay. So women with preeclampsia usually convulse, okay. So if the mother is hypertensive, they cannot deliver in the lying-in clinic. They must deliver or they must consult obstetrician or medical doctor in the facility or in the hospital. And of course, having fever. Fever is an indication of infection. It can be UTI or wherever there is an infection in the body of the pregnant mother. So all this, we educate the women about these danger signs, when to consult, and when and where. Okay, we advise them the facility they may go to for advice. Okay, next slide. Okay, for the summary, this intervention includes health education in women in relation to pregnancy, such as health system intervention to improve the utilization and quality of antenatal care, maternal and fetal assessment, dietary intervention, preventive measures, intervention for common physiologic symptoms. Number one means going to the facility, having prenatal checkup in the health center or in the hospital. Okay. Then, of course, in the hospital, we have this laboratory for CBC, ultrasound. Okay. There is the ultrasound department in the facility or in public ultrasound clinics. Maternal and fetal assessment is being done during the antenatal checkup in the health center as well as in the lying-in and of course in the hospital. For dietary intervention, we educate the women what kind of food they should eat, okay, the different variety of foods needed during pregnancy for them and for the developing fetus. And preventive measures is with regards to their lifestyle, drinking of alcohol, drugs, and of course smoking, and the importance of sleep as well and personal hygiene. And for the intervention for common physiologic symptoms, what to do if they have, for example, easy fatigability. So the midwife would advise, okay, independent midwifery intervention for those mothers having some difficulty adjusting to their pregnancy. Okay, we midwives has the knowledge and the skills in educating all women And our objective is to have a healthy mother and a healthy infant at during pregnancy as well as after pregnancy. Next slide. Okay. Thank you very much. Terima kasih. Okay.
Thank you very much, Dr. Ramajo. So that is the end of the presentation of our second speaker today in this conference. And for any one of you who would like to leave a comment or you want to ask a question, clarify something, feel free. This is the time. You can raise your hand straight away directly on the Zoom. You can type your question, or as I said, you can speak directly. The committee will allow you to speak, allow you, the speaker, to ask your question directly via the Zoom.
Okay.
Okay, now question has been raised by Musharrafa Mustafa from Health Polytechnic of Semarang, Dr. Maria. So Musharrafa concerns about preeclampsia and eclampsia, complication of ongoing pregnancy, typical symptoms of hypertension, edema in urine protein. This condition prevented from the beginning of the pregnancy through early detection of risk factors and health promotion efforts through health education about preeclampsia prevention efforts. So Musharrafa asked about your opinion. Apart from education and health promotion, what sort of efforts have been made to reduce the mortality rate of pregnant women with preeclampsia?
Okay, so that is a very good question. Thank you, Musharrafa Mustafa. Okay, that is a very good question. And nowadays, as I had told earlier, every pregnancy nowadays is high risk. They considered every pregnancy is high risk. Okay, most particularly, this is a very big problem with regards to pregnancy, preeclampsia, and eclampsia. Yeah. Okay. So your question is how to prevent eclampsia and preeclampsia, knowing the pathophysiology of preeclampsia and eclampsia. Okay, what are the contributory factors with regards to this matter during pregnancy? It is on the genes of the mother. So for example, the lineage of the mother, their family are having diabetes, or they are hypertensive, or they have cardiac problem. Okay, for sure, during pregnancy of this particular women having this lineage of medical problem, okay, pregnancy will give this pregnant mother, okay, the consequences of this hereditary illnesses. Why? Because during pregnancy, all the body systems are being disturbed. Remember that. Okay, we learned that from school. Okay, so now, in educating, so if we learn, okay, during the interview of the mother, during their antenatal visit, we ask, what kind of illnesses does your mother have? Okay. Oh, what happened? I lost you. Okay.
Yeah, we can hear you okay.
What happened? Okay.
We can hear you okay, Dr. Maria.
Okay, but I cannot see you. What happened?
Oh, okay, because the committee is showing the question on the screen.
Okay. I will try. Okay, and still, okay. So if you can hear me, I will continue my answer. So
yeah, please.
You can help the mother by educating the mother through having a full assessment during the interview, knowing their medical problem in their family. Okay, so you can advise the mother, okay, what kind of food she must eat during pregnancy, what kind of food to avoid, okay, and to avoid stress, to prevent hypertension, okay, and of course, everything that is being, that contributes, no, to these complications, okay. And still, it is medical intervention is very much needed for this mother having preeclampsia and eclampsia, okay. So early detection Okay, so what happened? My screen is blocked.
Oh, your screen is blocked?
Yeah,
Oh,
yeah.
we can actually
Okay,
your
I cannot
screen.
see you. I'm
Oh,
pressing.
you wanna show your screen?
Okay, nothing in my screen. But I can hear you, sir.
Okay.
Yeah. Okay.
Hang on.
It happened several times already. Yeah.
Yeah, I'll ask the committee to allow your screen
Okay.
sharing.
Thank you. Thank you.
Okay, just a second. Right.
Okay. Sorry.
Yeah. Would you like to try it again? The committee has actually allowed your screen sharing.
Okay. But here in my laptop, I cannot see you. I'm wondering why. So
I'm not sure about it because on our screen we actually in the hole in here what we can see is
you can see me
my
there.
face, your face, and
Okay.
all the participants.
Really? Okay, so I'm having trouble with my screen. So
Yeah.
to
At
answer
least
the
we
question,
can
I
hear
will
your voice.
continue. Okay, I will
Yeah.
continue. So to prevent
Please.
maternal mortality and morbidity, okay, early detection and early management of this pre-eclamptic women is very much needed. Okay, so if the woman is having this history of medical problems such as hypertension and diabetes in their family, they should be on close watch. Okay, so there will be collaboration of different specialists, the obstetrician, and of course the endocrinologists in the hospital. They will work together to assess and monitor and care for these particular women. Okay, did I answer your question right?
Right. To
Okay.
Miss or Mr. Musharrafa, we hope that answer your question. If there's anything you would like to say or you want to follow up, please do. Otherwise, we shall.
Okay. Any other question? There are three hands that is being raised. So, what is the next question? Okay. Hello?
I'm sorry, I forgot to turn on my microphone. I'm really sorry
Okay.
about it. Okay, so
Okay, sir. Yeah.
yeah, I
So,
think that should answer the question. I'll
yeah.
just ask to Mr. or Mrs. Musharrafa. We hope that answered the question. But if you would like to say something or you want to follow up, please feel free. Right.
Okay.
I think that should
So,
answer the question, Dr. Maria.
okay. Thank you very
Right.
much. Okay, how about for the next question?
Yeah, the next question is appearing on the screen. Can you see the screen right now?
Okay, I cannot see it. Can we read the question for me, please?
Right, I'll do that. This is a question from Ananda Nurfadila, a student from Health Polytechnic of Gorontalo. So the question is about, is the nutrition for pregnant women who are overweight or obese, is it normal for bleeding to occur within a week after giving birth?
Okay. So,
Because as far as I know,
okay.
bleeding usually only occurs after giving birth.
Yeah, yes. And of course, there are also bleeding before giving birth. That is, for example, for miscarriage, if the mother, okay, accidentally there is a traumatic experience of the mother. For example, the abdomen is being bumped, so it may lead to miscarriage or bleeding, vaginal bleeding. Okay, so going back to the question about nutrition with regards to obesity. Am I right? Okay. So what is the major question for that?
So, can you hear me?
Yeah, yes.
Yeah.
I
So
can
the
hear you.
question is about
Though I cannot see you, but I can hear you. Yeah.
bleeding usually occurs after giving birth. So she's just trying to
Ah,
confirm. She's
yeah.
trying to confirm.
Okay. So what happens? Okay, why those women become so fat after giving birth? Because they lack exercise. Yeah. So if the mother, before pregnancy, during pregnancy, they do the exercises, the pelvic tilt, and so on and so forth. And then after giving birth, they they become stagnant in the home, no, that just doing the household chores. Okay. Then they eat so much. That's the reason they become so obese or fat. But if they will continue doing the exercises, their body shape will be restored. Okay. They will become sexy again, of course. Okay. So exercise is very much needed, just like start from walking and then light exercises. Okay. After during postpartum is advisable. Okay. As long as there is no contraindications. Okay. To prevent obesity after giving birth. Okay. And I know for a fact that Indonesian are, I never see so many big Indonesians in Indonesia. Okay, when I was there. Okay. Mm.
Okay.
Because you are very fan of eating vegetables and fruits, am I right? And fish. That's why you have a very good nutrition in your country. Okay. And of course, we should avoid those fast foods. Okay. Uh, those food being fried. Oh, no. Okay. And meat. Okay. That's it.
Right.
And less of carbo. Yeah. Okay. So there must be also diet. The diet must also be considered into the prevention of obesity after pregnancy. Okay. Did I answer your question?
Yeah. Ananda, does it answer your question? Oh, by the way, Miss Mushorra, the one who asked a question previously, just said on the chat box, she said, "Thank you for your answer, Mrs. Maria."
Okay. Thank you too.
Yeah. Okay.
Do we have another question?
Yeah, I think that should answer the second question, and let's move on to the next one. This one from
Okay.
Miss Wahyuni Mohune, Health
Okay.
Polytechnic of Gorontalo. Is it normal for bleeding to occur? Oh, this is the previous question. Next one is from Nisrina. What are the
Okay.
special tricks that need to be done in order to establish good communication between the midwife and the patient?
Okay. So, okay. Uh, now we're teaching our midwifery students about the attributes of a midwife based on ICM, the International Confederation of Midwife, and as well as on the we have this training under UNFP, wherein the good attributes of midwives is being taught for us to disseminate to our students during their study days, okay, in midwifery, wherein, okay, all the good attributes a midwife should possess in caring for women during pregnancy should be, okay, these attributes must be possessed by the midwife in communicating with the women. So, what are these attributes? Okay, okay, woman-centered care. Okay, what does that mean? Woman-centered care. So when you talk to the woman, there must be compassion, there must be caring. Okay, you must be accommodating. Your tone of voice. Okay, no, the manner you speak, your face, your body language, okay? And of course, how do you approach them? Okay. Okay, this is very important. And communication is very important. Okay. Uh, there must be a feeling that you welcome them. You want to help them. Okay? No? So these pregnant women will go to you, will ask help from you because you're accommodating. Your smile is there when they reach for you. Okay? No? Okay. We must not lose these characteristics or these attributes. Okay? We are the frontliners in the healthcare. Okay? Most particularly this time of pandemic. The midwives are being deployed in different arena, in different areas in the community. Okay. We don't just face the mother, the pregnant mother, okay, but the whole family. Okay. We don't just care for the mother or the baby or the children, but the whole family as well as the community. Okay. If we have a healthy mother, we have a healthy family. And if every mother is being cared for and being communicated properly, the community is healthy. If the community is healthy, okay, the whole Indonesia, the whole country will be healthy. Okay? So, okay, communication, character. Okay. Character is very important.
Okay,
Okay,
communication is
sorry,
really
sorry,
important.
sorry. Okay,
Yeah.
sorry. Sorry for that. Sorry for that. Okay, so that's it.
Yeah.
That's
Okay.
it.
So,
So,
we
okay.
hope that answered the question
Sorry.
from Miss Nisrina. Um, and I think we shall move on to the next one. Because I missed the previous question. It's a simple one, but I think this one is quite important. Um, is Committee, would you like to go back to Ananda's question? Okay. Is the nutrition for pregnant women who are overweight or obese? The nutrition, right? Dr. Maria, you mentioned about nutrition, right? So Ananda is asking, is it for
Sorry
overweight?
about that. Sorry.
Can you hear me okay? Dr. Maria, can you hear me?
Did I answer your question?
Yeah, you've
Okay.
answered the previous one about the bleeding and
Okay,
stuff.
sorry for that. Sorry for that. There is an interruption.
Mm-hmm. But I think you haven't covered
Okay,
this
sorry.
question. Yeah, it's okay. It's
Okay,
okay.
so is there any other question for?
Yeah, I'm mentioning, I'm giving you a new question. This is I missed this question actually. Is the nutrition for pregnant women who are overweight or for obese women?
Okay. Okay, sorry for that. Sorry. Okay, so sir, sorry. Okay.
Okay.
Okay, so what is the question? What do you think?
The question is about, is the nutrition for pregnant women who are overweight or obese?
So what is it? I
Ah,
have answered that question already, sir.
Ananda is just trying to confirm.
Yeah.
Is it right? The nutrition is very
Yes.
suitable to be given for pregnant women.
Okay. So we must
How
educate or teach
important?
the women the proper food to be eaten during pregnancy. Okay. So
I think this question is about how important giving nutrition to pregnant women, because you mentioned about nutrition. Yeah. Can you hear me okay?
okay, sorry.
Do you want me to repeat the question?
Okay, please repeat the
Yeah.
question.
Yeah. So the Ananda is trying to confirm, because you mentioned about nutrition.
Yeah.
How important to give nutrition for pregnant women?
Okay. Nutrition is very important because uh, if the mother is undernourished, the mother is undernourished, the end result of pregnancy will be underweight baby. Underweight baby. Okay.
Yeah. Okay.
Sorry.
It's
Okay.
fine. It's fine, Dr. Maria.
Okay.
Next question, please. Committee, please make it available on the screen. Okay. The next question from Cindy Biga, Health Polytechnic of Gorontalo. What will happen if pregnant women are allergic to FE tablets, while what we know is that FE tablets are additional vitamins for pregnant women in preventing pregnant women from developing anemia. And what action will the midwife take to solve the problem? Are there other vitamins to solve the problem? That's the question, Dr. Maria.
So the question is about if the mother is allergic to ferrous sulfate tablets. Okay, there are other means. You can give the mother, for example, the green leafy vegetables. The green leafy vegetables, which is available in the backyard. Okay. Okay. Aside from that, okay, iron is very, this small fish, we call this dilis. I don't know what you call this one, but I see, I have eaten peanuts with this small fish. We call this here in the Philippines, dilis. I don't know what you call this. This particular fish is very rich in iron. Okay. No, aside from green leafy vegetables. Okay. So if the mother is allergic to ferrous sulfate tablets, you can advise them to eat this, eat more of this kind of vegetables, the green vegetables, and this kind of fish, which is very rich in iron. We call this alternative food for in addressing this particular problem. Okay. So what else in the? Did I answer your question right, Cindy?
Yeah, I think that should answer the question. So you just mentioned green vegetables, right? And the fish.
Yeah.
Wow, that sounds really useful.
Yes. Yeah.
Okay. Shall we move on to the next one? The next question comes from Rizky Amelia Polkesmar. According to your presentation, IFA tablets are given to the pregnant woman since 4 months. Is there any specific explanation about this? Because usually we give the folic acid more early since the first month to reduce the risk of incidence of congenital defects for the baby. That's the question.
Okay. Okay. So the folic acid, okay. Normally we give this, we don't give this EFA tablets on the first trimester. We give this on the second try. Why? You're asking why, the reason for this. Okay. Because to prevent any harm to the developing fetus, and as well as the mother needs this particular kind of nutrients during the second trimester. Okay, it is more being absorbed more during this time. They don't need this on the first trimester. That is the reason. Here in the Philippines, we practice that. Okay.
Right. Okay.
Okay.
Hope that answers the questions. Okay. Right. Next one. There's somebody who's raising a hand on the Zoom. Maybe she would like to speak directly with you,
okay.
To you, Dr. Maria. We would like to give the opportunity to Fadila, who is raising hand. Please, Fadila, feel free. It's your time. It's your opportunity. Fadila, silakan. Yeah. The committee, please allow Fadila speaker to speak. Yeah. Fadila, can you try to speak? Check your speaker.
Yeah, thank you, sir.
Yeah, okay.
Hello, Miss Maria.
Would you please, hang on a second. Would you please to speak slowly because we get the feedback in here. Please speak slowly. Yeah. Yeah, silakan. Fadila, please. Yeah, Fadila, can you hear me?
Thank you, sir.
Yeah.
Hello, Miss. So my questions. What if the mother is about to give birth and would like to have a normal birth, but during the delivery stage takes too long? Should the attending physician or immediate perform a C-section?
Right. Do you get the
Okay.
idea, Dr. Maria?
So that is your answer. That is your question. Okay. Okay. Normally, we discourage cesarean section. Okay. So for those women having no complications, cesarean section is not being advised. Okay. Okay. Even though the mother wants to have a cesarean section, but there is no need for cesarean section, it will not be granted to that women. You know why? Okay. Because having an operation entails a more dangerous outcome. Number one, it may lead to infection because there will be a bigger wounds aside from the perineal tear. Okay? And aside from that, okay, the healing process is long. Where if you give or gave birth normally, okay, and there is no laceration, no perineal laceration after 24 hours, the mother can go home. Where if the mother is being give birth through cesarean section, 3 to 5 days she will stay in the hospital, and it costs a lot of money. Okay, so okay, it ranges from 20,000 to 100,000 per cesarean section. So the question is, does the mother have that amount of money? Okay. Even though they are rich, they have the money, but there is no indication for cesarean section. The obstetrician or the attending physician will not advise a cesarean section. Okay, that's it.
Yeah.
Okay. If the obstetrician really care for the mother and the newborn, the delivery must be through a normal spontaneous delivery so that the mother can recover immediately and can do breastfeeding without any pain on the perineal and on the abdominal area of the mother. Okay? No? So again, I will repeat, even the mother will ask, do the cesarean because I don't want to have labor pain. Okay, but there is no indication. The obstetrician, even though the obstetrician can gain more money through a cesarean section, okay, the OB or the surgeon will not do that. Okay, did I answer your question?
Yeah. Does that answer the question? Your question, Fadila?
Arela, are you satisfied?
She's smiling to you.
Yes, she's smiling.
Right. We hope that answered the question. Right. Shall we move on to the next one? The committee, please show on the screen the next question, please. Okay. Dr. Maria, can you see the screen now?
Yes, sir, I can see it.
Sounds really good. Yeah.
Okay.
Okay, so the next one comes from Ismi Wahyuni Latif from Poltekkes Health Polytechnic of Gorontalo. What do you think about the health of pregnant women based on culture but deviating from a health perspective? For example, eating taboos by pregnant women in certain cultures where pregnant women are prohibited from eating things that according to that culture should not be eaten. Thank you. This is about culture. Interesting.
Yeah, very interesting. Okay. When I go there to your country, there are so many different things that we learn from your culture. Okay. Even here in the Philippines, we have these myths. We have this beliefs. Okay. Depending upon what country are you. Okay. So, okay, in your question, give me one particular thing about eating. So, for example, okay, in your country, pregnant women are not allowed to eat what particular fruit? Twin bananas? Twin bananas? You're not the pregnant mothers should not eat twin bananas that are not separated, okay? Because they might have Siamese twins. Is that a good example?
Yeah, there's
Okay.
no certain example in here. I'm not really sure
Yeah.
because
Yeah.
I
Okay. So I know that the case thinking
maybe you
of
could mention one example in. Is there anything like that in your country in Philippines? A taboo
yeah,
to like
yeah,
prohibition
yes,
to eat a
yes.
certain food? Yep,
Mm.
please.
That's like this. We have this particular banana wherein every single banana is being attached to each other. Okay, so those pregnant women are not allowed to eat this type of bananas. Okay, to
Yeah.
prevent Siamese twins. Okay, do you have that also in your country? Or for example, this particular fruit, it may lead to abortion if the pregnant mother will eat this. Okay, there
Mm.
are but those are just myths. In reality, based on research, it is not true. Okay. Okay. And of course, I have also learned that in your country you have this the placenta. The placenta is being okay left there and dried there. Okay. We don't do that here in the Philippines, but you do that in your country, and there's no harm on that. Okay.
Okay.
Yeah. You're doing that. There's no harm on the mother as well as on the infant. Okay. And I also know that a piece of the placenta is being cooked and being eaten by the mother. There's no problem on that as long as the placenta is clean. Okay. And what is the consistency of the placenta? It is protein actually. No? So no harm being given to the mother while doing that. Okay. So what else? Vegetables, kind of vegetables, because connote, they connote that if they eat this particular vegetable, the child will become like this kind of vegetable or this kind of fruit. Okay. In my experience in the delivery room, this is one particular cesarean section where uh, there is twins. There is twins. The first twin, the mother during her pregnancy is very fond of looking on the half moon. Class, on the half moon. I sorry, class. Uh, participants. Okay. The mother is very fond of looking on the half moon. No? The mother gave birth to a twin. The first the first twin is normal, human, but the second twin is shaped like a new moon. I have seen that in my eyes. Okay? Huh? So what happened? Is Kobade real? Is Kobade? Do you know Kobade? In the Philippines we call that paglilihe. Okay? We have
Mm.
similar words in Indonesia just like here in the Philippines. Paglilihe on the first trimester. Okay. So pregnant women are not allowed to look on for example to make fun of animals or not looking persons just like that. Okay? So okay.
Yeah. Okay. I assume probably the assumptions are based on like myth or something because Indonesia, you've been to Indonesia and myth is still like everywhere, even in Gorontalo, in this hometown. Myth is, you know, if you come to Gorontalo, you should be able to find some myth in here.
Okay, looking forward on that. Okay. Okay. Did I answer your question,
Yeah,
Latif?
hope that answered the question. Isumi
Okay,
Wahyuni.
good. Okay.
Okay. Let's move on to the next one. This one from Fitra Rahayu. How to deal with mothers who do not want to be given knowledge, wow, about the importance of health for pregnant women. This is going to be challenging.
Very challenging, very
Mm.
challenging. There are so many women, most particularly those women who smoke. Am I right? Those women who smoke
Yeah,
and drink alcohol and engage in illegal
exactly.
drugs like
Mm.
marijuana, cocaine. Okay, okay. I have delivered one particular woman who is having shabu. Okay, during the delivery of the infant, she don't even know that she thought that the newborn or the infant is just a doll. So when we gave the newborn to her, she almost threw it. Yeah, she almost threw it. Okay, and you know, she did not submit herself for any prenatal checkup because she don't want to stop taking shabu, the illegal drugs. Okay, so now how to deal with mothers? Okay, it is our obligations and responsibility to explain to the mother the effect of this smoking, alcohol, and drugs, and what will be the outcome. Because if the mother died, no, if the mother died, okay, and the infant or the newborn is being left, what will happen to the infant? Okay, so if this mother a really hard-headed mother, okay, no, maybe there will be somebody in the family who can encourage this mother to submit herself for checkup if there is an if she really wants this pregnancy. You know that? Okay. So every pregnancy must be planned. Okay? Because this unwanted pregnancy always leads to hard-headed pregnant women because they don't like it. So they don't want to be educated. Okay? They will insist their bad habits. Okay? They just think of themselves. Okay? Because they don't want the pregnancy. But if it's wanted pregnancy, these women will submit themselves personally, okay, to the health clinic to be educated. Okay? So my answer is how to deal. Okay. If still the mother is not compliant or not submitting herself to the health facility, to the midwife, okay, look for somebody in the family that can encourage this mother and explain to her the importance of prenatal checkup. Okay? Did I answer your question?
Yeah, explain to her the importance
of
check,
okay, not to her,
checking,
but to the whole family. Okay,
yeah.
but to the whole family. But, for example, the pregnancy is out of wedlock. That is another problem. They are hiding their pregnancy. That is the reason they are not submitting themselves to the health facility. Okay, because this is unwanted pregnancy. Okay, so the role of the midwife in this matter is very crucial. Okay, because we're not just looking for one person here. There are two individuals that matters here: the mother and the infant. Am I right? Okay. Yeah.
Yeah.
So that's it.
Right. Hope that answered the question. Fitra Hayu Rifai from Health Polytechnic of Gorontalo. Right. Let's move on to the next question. Oh, okay. Fitra Hayu just said on the chat, Dr. Maria. Okay, thank you for your answer.
Thank you too for that question. That is a very challenging question, but we encountered that.
Yeah, it is.
Yeah. In the actual setting, in the ground, in the health center, we actually encountered that. The mother-in-law, the mother of the pregnant women bring their children to the nearest health center or to the nearest hospital to have their prenatal checkup. And they will argue with each other. I don't like. Okay, more particularly those adolescent women who get pregnant. Okay. And it is very challenging, very challenging. Okay, for the next question, how to prevent pregnant women who are malnourished. Okay, malnourished, so feed them. Okay, so you don't have much resources, meaning you don't have much money. There are so many vegetables in the backyard. No? Okay, we have plenty of, so we have this backyard gardening being encouraged here in the Philippines. So everybody, even most particularly this time of pandemic where we have this lockdown, you cannot go to the market to buy foods. So you raise your own chicken, have your own pig at the backyard and plant vegetables in your backyard. So I have different kind of herbal plants in my garden. Okay, we have mango tree. Okay, in my house. Yes, and of course different kinds of vegetables that gives us fresh vegetables when we need it. Okay, okay. It is. It depends upon the individual. If you are lazy, you will get hungry. But if you are not lazy, okay, okay, tilt the soil so you can eat. That's it. It is even written in the Bible. For those people who don't till the soil, they will not eat. So you must work in order to eat. Okay? So malnourished can be addressed, okay, even though you don't have a penny in your pocket. Okay. No?
Yeah.
So you have plenty of peanuts there. I have buy some peanuts. You have a particular area in Indonesia where they sell peanuts in different flavor and so on. Okay, so peanuts is a very good substitute for fish or chicken or pork because peanuts is very rich in protein. Okay, those green vegetables in you have the sweet potato tops, and whatever green vegetables you have in the garden, you just blanch it and then put some okay, seasoning or whatever or salt. Then that is good for the pregnant mother. They don't need to buy it anymore from the market. Okay? Okay. Malnourishment can be prevented as long as we educate those women the alternative. Okay?
Right.
Well, any other question?
Right. Agree with you, Dr. Maria. There are many alternatives, right? Many
Yeah.
alternatives, but you have to, work it out yourself. It doesn't have to be
Yes.
expensive, right?
Mm.
Okay.
Yes, you're right, sir. All right.
Yeah. Okay. Someone is raising hand.
Citra is raising her hands.